Hi, I'm Theresa Cullen. I'm a family medicine physician, and I currently am the Pima County Health Director in Southern Arizona. I became the Public Health Director in 2020. At that time, we had a small epi department, and we were unable to respond appropriately, meaning we couldn't keep up with the overwhelming onslaught of cases in a timely manner to ensure that we could do case investigation, contact tracing, and identify areas and communities that were at risk. And we eventually developed what we called an EIU, an Epidemiologic Intelligence Unit. That unit became responsible for the typical things with epidemiology: case investigation, contact tracing, follow-up. It worked for individual cases, but our ability to identify and respond to outbreaks seemed to be delayed. We were concerned that we were missing things. Lo and behold, Resolve and 717 came along and said, would you like to try this? At that point, we had also made a very intentional commitment to wanting to become a learning public health system. What that meant was that we would take information that we gathered and we would learn from it. Non-punitive, we would ensure that we had ways to track things with a metric. 717 gave us that metric. So at that point, we implemented 717, initially retrospectively, looking at a very significant number of school outbreaks that we had had since the beginning of COVID. We had worked closely with our schools, we had mandatory reporting of them, and we had data sets that we could look at. We went back, we evaluated how well we did with the 717 metric. We didn't necessarily meet those metrics, but what that enabled us to do was to identify what were the enablers and what were the stumblers. As a result of that, and doing a lot of really reflective after-action evaluation, we identified them and then we were able to act on them. And we not only needed to involve our epidemiologists, we needed to involve all of our other teams, our school team, our tribal team, our border team, our consumer food safety team, our public health preparedness team, and our clinical team. So this created this amazing opportunity for them to learn from each other, but also how they could accelerate and inform the other team members so that cohesively we could develop a really integrated approach and response to what we were seeing. So Pima County has really embraced this concept of becoming a learning public health system. What that means is that we take every opportunity we can to look at data, look at interactions, look at interventions, and see if there's ways to do it better. And the metric of 717 has been identified by our staff as the pilot metric for us to use to evaluate what the effectiveness and efficiency of the public health system and the ability to respond. Outbreaks occur. They occur regularly. Most of us can't predict when they're going to happen. For a public health department to have a tool to use to evaluate their response to that outbreak and whether they are improving or not is critical. But having the ability to track that with a metric that then you can share not only with your staff or with your administration, but also with your community is critical. That will give all of us, including Pima County, this ability to be able to say, you know, all this human and fiscal resources we put in to outbreaks mattered. Our community will know that we are looking at 717 as a way to evaluate the ability of the public health department to keep the community safe.